I think we're at a point in clinical neurology where we have biomarkers that are going to be extremely informative on the symptomatic disease, whether the cognitive decline is caused by Alzheimer's disease pathology or not. This is less clear in preclinical and MCI stage. So at this point we want to investigate how is this going to work in a therapeutic trial. Two aspects for a therapeutic trial in terms of a biomarker. You want a cross-sectional screening tool to identify if someone has pathology or not that would be entered into a trial. And second of all, you want to have a biomarker that monitors meaningful change over time. So if a disease is progressing, can the biomarker show that? And hopefully when you have a therapeutic trial intervention, that it will respond to that as well. So that was the basis of the investigation. What we found is that we actually measured many different biomarkers outside of phospho-tau, so also GFAP and A-beta-40/42, very well-known biomarkers and have been published before. And that this cross-sectional biomarker at the very early stages, so no symptoms but accumulating amyloid pathology, found that this phospho-tau 231 epitope had a larger change at this particular, it was very subtle, but it had a larger change than other biomarkers at this stage. So we can conclude that this may be the biomarker for screening. If you're looking to screen at the MCI stage, so a subtle cognitive impairment, it was very, very clear that the epitope of 217 was the biomarker you would use at that stage. So it's very much dependent on what your therapeutic trial is looking. Longitudinally, however, how you progress over 6 years, we did serial measurements of these biomarkers following people that were amyloid positive that progressed from no symptoms to mild symptoms. And interestingly, not many of these biomarkers changed actually over this time, but the 217 biomarker was tracking cognitive decline and also atrophy in the brain. So this is a biomarker that we'd be able to monitor disease over a short period of a clinical trial. Where we need to start now focusing is on other types of neurodegenerative disorders. So, okay, we can say that you have or do not have Alzheimer's disease, but if you don't have Alzheimer's disease, what do you have? And there was some preliminary data on alpha-synuclein PET, which was mentioned in a plenary talk by Oscar Hansen. This is a major breakthrough because our plasma biomarkers are driven by these key biomarkers that we have in imaging. So for order for us to find a fluid biomarker, we need to understand in vivo what's going in the brain. So having a measure of alpha-synuclein by imaging is going to be really key for us to develop tests in the future.